The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Acupuncture focuses on the connection between the mind, body, and spirit. It concentrates on the flow of qi through the body, which is life's energy. Stay tuned for more about acupuncture in just a moment. Welcome back. Tonight's topic is acupuncture. We have with us in our studio Jason Richards from Austin Acupuncture Clinic and Christie Dick from Hayfield, Minnesota. She has a unique story to share with us later on in this episode about acupuncture and how it's affected her life. Jason, let's talk about acupuncture as a therapeutic practice. How did you become interested in acupuncture to begin with?
Well, I don't really have a good story to answer that. I thought about being a veterinarian, thought about being a pharmacist, and figured out those weren't really the right path for me. So acupuncture just seemed to be the right thing. Probably watched too many kung fu movies growing up.
Yes. Now, acupuncturists often refer to qi. Can you explain a little bit about qi?
Well, it depends on who you're asking. It depends on who you're talking to. A lot of medical doctors would say that it's the hormones, it's the energy, it's the oxygenation of the blood, it's the ATP, if you remember that from chemistry class. The Chinese practitioners would talk more about the energy of the body, the breath of the body, and that energy passes through certain meridians or channels or circuits throughout the body. And if they get clogged up or cinched up, like a water hose being cinched up, then you have a blockage and the different organs don't function correctly, or you have ache or pain or any type of dysfunction.
So let's talk about these meridians a little bit. They're channels that run through the body, is that right?
Right, sort of like the circuitry in your house. You know, if you have a light bulb out in your attic, doesn't necessarily mean that you have to grab a ladder and a light bulb. It could be that you have to flip a switch down in the basement to open up the circuit. Same thing with acupuncture. That's kind of the old way of thinking about acupuncture. So if somebody has a backache, you know, if the muscles are cinched up, it's not necessarily that the muscles are broken or injured. It could be just that you have to flip a switch on the ankle, and it helps relax the muscles, and the oxygen and the blood gets to the muscles, and the problem goes away.
So it's really about flow, and you're opening up those channels so that the blood can flow. What other systems do you work with? You talked a little bit earlier with me about endocrinology. So besides blood, what other kinds of flow are we talking about when we talk about qi?
Well, yeah, there's a lot of different kind of levels to acupuncture. You can take care of the spirit, take care of the qi or the energy, take care of the blood, take care of the fluids of the body, the essence of the body. So those are all kind of technical TCM, traditional Chinese medicine terminology. Okay. But more modern-wise, we just talk about influencing, creating more endorphins in the body, and regulating the hormones and things like that.
And you talked a little bit about the yin and the yang. Now, how are those balanced through acupuncture?
I don't know.
Okay.
You can ask some of the greatest minds that are actually studying this stuff in the laboratory, and they don't really have a good bead on explaining how acupuncture works. But then again, you know, if you ask a typical doctor how aspirin works, they'd be kind of hard-pressed to answer that as well.
Right. It's still being studied, huh? Now, we've heard a little bit about sham acupuncture. What is that?
That is acupuncture that doesn't use kind of like known acupuncture points. So like if you do acupuncture here, it'll elicit a certain effect. But if you stick a needle here, there's not a known acupuncture point there, but you'll still get some effect. And in some studies, you get almost as good of an effect with sham acupuncture as the traditional Chinese acupuncture. But apparently, if you use the acupuncture points the way that they're meant to be, and in different combinations, then you get even a better effect than the sham acupuncture.
Sure. And what are the most common ailments that people come and see you to treat?
Basically, the biggest sellers, so to speak, are aches and pains, back aches, bad knees, bad shoulders, elbows, knees, a lot of migraine headaches, gynecological problems, fertility.
That's a lot right there. A lot of things that we found.
Digestive issues predominantly as well.
And this might be a really difficult question, but what does acupuncture do that massage wouldn't do? And we were talking about massage as opening up, massaging the tissues and opening up some channels and getting things to flow. How does acupuncture work differently?
I think it's just a little more specific, a little more pinpoint accuracy, so to speak. I really think that you can get the same effect with massage as acupuncture. It's just a lot more time intensive. You can get you kind of cut to the chase and get the same effect with acupuncture a lot more readily and with fewer treatments and sometimes instantaneously.
Sure. Yeah. And do you ever see people that come in just to use it as a relaxation technique?
Sure do. Yep. A lot of people that come in for one particular problem, and once that issue is resolved, then they like the side effects of acupuncture so much that they just keep on hanging around and keep coming back.
And that kind of leads into the root and branch approach to treatment, doesn't it? Like you're not only treating the symptoms, you're treating the root cause. Is that correct?
Right. Yeah. And that's kind of a big thing behind acupuncture is you don't want to just take care of the symptoms, because it's like the dandelions in your yard. If you just pick off the heads of the flowers, the roots are still there, and they're going to come back. With acupuncture and just Chinese medicine in general, you're always trying to take care of the symptoms, the branches, but also the root cause. Okay. And quite often, if you can get rid of that root cause, all the different branches kind of wither up and take care of themselves. So you take care of one problem, the underlying cause, and their migraine headaches go away, their digestive issues go away, their bad back goes away, all at the same time.
So when someone comes in and says, I have such and such a symptom, what do you do to get to that root cause? How do you find out what's really ailing them?
Well, you just ask a whole bunch of questions. Just ask them. You can take the pulse. You can look at their tongue. Some acupuncturists say, look at the eye or study the ears, see what type of formations are going on.
And when you read the tongue, tell me a little bit about that. Like someone with, say someone who's undergoing chemotherapy, or maybe even someone who's exposed to repetitive exposure to toxins. What would their tongue look like versus like you or I?
Well, the tongue's a really good diagnostic tool. It's one of the hallmarks of Chinese diagnosis. It's sort of like looking at a muscle. It's one of the most used muscles in the body for a lot of people, more so than others. But it's sort of like peeling back a window of skin to see if your muscles are red and inflamed, or if they're pale and undernourished of blood, or if they're purple and stagnant and kind of bruised. And you can see that in the tongue. So if there's stagnation going on, not enough circulation, there'll be purple or lavender. Or if it's pale, there's not enough blood being circulated. Sometimes it's red and inflamed. Sometimes it's scalloped and swollen. And somebody that has a lot of toxins in their body, it really just depends. It could be, it could look like anything really. That's the whole idea behind acupuncture. One diagnostic criteria doesn't dictate your treatment. You have to put all the different pieces together and get a kind of a global picture of the person.
So where do you start if someone has a ton of issues? You start with pain just because that's what's bothering them most, or?
Realistically, you just make a list and you take care of all of them at the same time. You kind of typically you take care of the root problem, and that main chief complaint will resolve itself on its own. Some acupuncturists don't. They'll just take care of the one problem that the person comes in with.
Okay, but mostly you're trying to treat the whole body.
Mm-hmm.
I was reading an article on acupuncture, and it said when a person has allergies, for example, you said that maybe people come in for allergy treatments, your histamines overreact to the pollen in the air. And since pollen is harmless to your body, your histamines really shouldn't do that. So what acupuncture does is it tames down the histamines. And I think you told me something like this too. And just gets the body to get rid of that weakness that it has to overreact to things like that.
Right.
So is that accurate?
Right, yeah. Just statistically and with the studies that they've done, acupuncture seems to be very good for all types of inflammation and allergies and things like that.
Neat. And it opens up the sinuses and just gets everything flowing.
Very much, yeah, very dramatically.
Great.
Yep.
Well, we made a visit to Austin Acupuncture Clinic earlier this week, and we have a little footage to show you. And Jason, maybe as we watch this footage, you could walk us through what you normally do when a patient comes in to see you. So what's the first thing you do?
Well, apparently pulse. Yep, you take the pulse diagnosis, and it's a little bit different with an acupuncturist, because normally when a doctor or nurse takes your pulse, they just want to see how fast your heart's pumping away. But with an acupuncturist, what you're looking for is if the pulse is thready, feels like a guitar wire or a piano string, or sometimes it's soft and squishy like a water balloon. Sometimes it's wide, sometimes narrow, sometimes deep. And you can actually gather information about the different organs in the body. Again, it's one of the hallmarks of Chinese diagnosis. They've been doing pulse diagnosis this way for about 2,000-3,000 years.
Wow.
Yeah. And so you can see how the gallbladder is functioning, and the large intestine, and the heart, and liver, and kidneys, and so on.
And then you can figure out where the stagnation is, so to speak?
Sure can, yeah.
Okay.
Hyperactivity, underactivity, yeah. And once we gather all the information and kind of make a diagnosis, and you just do some acupuncture, yeah. Certain acupuncture points. You make a point formula.
And do you always start at the top and go down, or how does that work? Or you start at the feet and go up? How does that work?
It really depends on kind of the formula, the recipe
Okay.
of acupuncture points that you're
And
using.
you learn these recipes over time, just as you practice. You memorize them, and you certainly you're so experienced now you don't have to look it up anymore. But these are things that
acupuncture is so easy. Yeah, it's the easiest thing.
No, it's not. I don't believe you.
There's about 1,000 points in the body to pick and choose from, so you can combine them.
Oh, my.
Literally, you can go to an acupuncturist 100 times and get 100 different combination of points, and they're all going to be equally effective as long as the acupuncturist is kind of following the rules and the protocols and knows how to properly combine points together for the best effect.
So what are you doing right there? Did I see a plastic piece?
Oh,
or
yeah,
something?
that's it's just a little straw, and when it pushes down on the skin, it kind of draws the skin taut like a drum. So when you do tap the needle in, it slips in much easier, much more pain-free.
Neat. So this was the allergy treatment that you were giving me, and I did feel it the next day. That was really interesting.
Very cool.
Yeah. So then, after you get the needles in, what do you do then?
You just rest for about a half an hour. It depends. Some acupuncturists, they just do some like acupuncture tacks, sort of like intradermal needles, where they'll nice toes. So intradermal needles, they'll put them on there, cover them up with a piece of tape, and it's a very thin, small needle, and it doesn't even penetrate the skin all the way. And so you're in and out of their office in about 5 minutes, 10 minutes, and that's their treatment. Other acupuncturists, they'll spend an hour with one patient. Here we kind of even it out, so you're there for about an hour. We see about three patients an hour, so yeah, you get about 20 minutes to get a treatment. The first treatment typically lasts longer because you're doing a lot more intake. Yeah, and there we're just
by intake you mean
the
evaluation.
Yep.
Yes.
Mm-hmm.
And I was also interested to see all of the herbs that you had at your clinic, and you use those in conjunction with the acupuncture treatment.
Acupuncture is actually kind of a modern therapy. It's about 1,500 years old compared to traditional herbal medicine, Chinese herbal medicine, which is about 3,000 to 4,000 years old. Chinese medicine is considered the world's first scientifically based medicine, where back when the European doctors were making potions and chanting, the Chinese, they were opening up hospitals and experimenting with different herbs and doing autopsies and dissections, and They had the first medical schools and group clinics. So, yeah.
Neat. So herbs in addition to acupuncture treatment. That's the way to go.
Yep.
Wonderful. Thank you for all that information. Now we're going to move to Christie Dick. In the summer of 2005, the Colorado Center for Reproductive Medicine was named the #1 fertility clinic in the country. Christie Dick of Hayfield, Minnesota, has a unique story to share with us regarding infertility treatment and acupuncture. Christie, please start with telling us a little bit about how you began your fertility treatment process.
Well, 8 years ago, my husband and I decided it was time to start a family, and we started working the usual way that everyone does in trying to get a family, and things just weren't working for us. And so we were working with a number of different medical doctors and trying to go through a number of tests and trying to determine what was the root cause of all of the issues in not being able to conceive. We ended up being referred to some specialists in the area, which led us to working on in vitro fertilization. And through our whole process of in vitro fertilization, I was searching for some sort of answers to our issues, as well as the doctors were, and I had tried going through massage and trying to do relaxation, thinking that that might be the cause of me being a little bit too nervous and trying to conceive. And we went through 4 different IVF transfers of embryo transfers to me, and none of them were successful. So we sat and talked with the doctors and trying to determine what our next course of action would be in trying to obtain the family we so wanted. And in some of my questions, it just seemed that through the whole infertility process, the doctors would tell me and my husband that the egg and the sperm were all looking good. They would do the uniting of it and form the embryos. And when it was time to transfer the embryos to us, they were all looking good, high quality embryos. But after the transfer, we just never saw any results of a pregnancy. So after 4 times of trying that whole process and going through all of the hormone treatments, injections, I asked the question to my doctor of how do we try to treat the actual implantation of the embryo into my uterus, because that seemed to be the lacking point in me conceiving for our children. And so in that process, my doctor had talked about a doctor in Colorado who was doing some research that was working on an embryonic glue. And this embryonic glue was, they ran your embryos through this glue prior to doing an IVF transfer process, and this glue was supposed to help the embryo stick to the uterine lining.
Wow.
And help implantation.
So, did it work?
Well, of course, yeah. But that
was it the glue alone that helped the success, or where does the acupuncture piece come in? Because I know that, did you try the glue alone, or what did they recommend?
So after my local doctor had talked about this embryonic glue, I went onto the internet and did some searching to try to track down this doctor to find out who he was and where he was working. And that's where I came to the Colorado Center of Reproductive Medicine. And so I did an initial consultation with them and gave them my whole story on what we had tried locally and what, our failed attempts, what our numbers and everything looked like. And then the Colorado Center for Reproductive Medicine asked me to come down there for an initial medical assessment. So they went through all of the assessments, and their initial diagnosis for me was low blood flow to the uterus. And their treatment for low blood flow was to have acupuncture.
So let's back up. Do they give everyone this embryonic glue? Is that kind of standard practice?
Yeah, that's standard practice for them. But so I was really interested in that because I thought that was my glue to getting my child. But in addition to that, I was just seeking the glue. But in addition to that, They gave me the treatment of acupuncture, and I actually think the acupuncture was probably the key to our success, because when they had first diagnosed me with low blood flow to the uterus, I came back home to Rochester at the time and worked with an acupuncturist there and went through treatment to direct the energy to my uterus to increase the blood flow. And when I was ready to go back, I did treatment with that acupuncturist for about 2 months, going about twice a week. And after that, I was ready to go through another IVF transfer or retrieval and transfer cycle. So,
and how did you know you were ready after those 2 months?
All of that was just determined by the calendar and medical, in them doing the hormone stimulation and things like that.
Sure.
So according to the calendar, I was ready.
Okay.
And so when I got back down to Colorado, they initially, or the first thing they did when I returned there was did a Doppler ultrasound, again, looking at my uterus, and lo and behold, the blood flow had increased, and it was to the exact levels, the magical levels that they wanted for me to conceive my child. And so I went through that treatment, and going through all of the acupuncture, you know, there would be days I would walk into the office and I'd have a headache, and they would treat that. They would put the needles someplace, and I would walk out and I would feel no headache. And this last, in one of my cycles through, I realized after conceiving my first children, which were twins, I realized I had a lot more patience with my children while I was going through acupuncture for my third child. So there's a lot of benefits to it. Something different that I did when I got to Colorado, I continued my acupuncture all through my IVF treatment. And so working up to my retrieval day, I did acupuncture, and they actually connected electrodes to the needles that were in my back. And so that would send a little bit of electric vibe through my body for additional stimulation that was, again, directed directly to the uterus.
An interesting thing that I happen to know in conjunction with this is you went through all of this treatment in 2004, 2005, when it was still somewhat experimental. There weren't studies published on this in vitro fertilization, and in conjunction with acupuncture and how acupuncture helps the success. But then in 2008, they finally published a study that showed how 7 experiments had all proven that this in vitro fertilization, that the success was so much greater. In fact, I think 65% increase in success rates of in vitro fertilization when having acupuncture before and after. And I think they've used it, is that right, Jason, for all stages of infertility?
Right. Yep. It's so effective that there's a lot of acupuncture fertility clinics all around the country. So a lot of acupuncturists, that's all they do is fertility.
That's neat. Well, anyway, I'm sorry to interrupt, Kristi, but that's unbelievable and cool that you went through it at a time when it was still somewhat experimental.
Well, and the Colorado doctors, you know, they're heavy into research, and they have the acupuncturists right there working with them in their research. So during my treatment, in conceiving my twins, the acupuncturists actually come to the medical facility, and I received acupuncture right before my transfer and immediately following my transfer to, again, try to get additional energy to my uterus to try to help the embryo implant.
So this worked for 2 different pregnancies. The first one you had twins, and then now you have your little Brady, who's only 2 months old.
Yes, so we tried for 4 years, and we got a success in 2005, and we went back one more time just this past year, and it worked again. So I'm 100% working the whole acupuncture thing with Colorado Center for Reproductive Medicine.
And the embryonic glue.
And the embryonic glue, yes.
That's wonderful. Oh, I'm so glad to hear it. And Kristi, now, will you continue to go to an acupuncturist for any other reason after you're done having your children?
I have to say, I absolutely love acupuncture. So I tried doing the whole massage thing, and I just couldn't relax enough. I think to get the full body relaxation, to let all of the circulation really take effect. The acupuncture part is, you know, simply putting this little needle in that is far less painful than a mosquito bite, actually, I would say. And then, you know, the acupuncturist walking out of the room, dimming the lights, and I fall asleep every time. So my problem is just finding the time to get my hour in a day to get to the acupuncturist to have him help me relax again.
Yes. And Jason, I think we talked about this before. Some insurance companies cover acupuncture. Does that depend on if you get a doctor referral like Kristi did with her Colorado fertility clinic, then is it more likely to be covered because it's referred? How does that work?
It really depends on the state that you're in and the company that you're dealing with and the policy that your employer got for you. So there's so many variables. It really depends.
Okay.
There are some companies that it has to be through a doctor, and there's several thousand doctors around the country that do acupuncture.
Oh, okay. The doctor actually has to do it. But, oh, wonderful. Well, I thank you both for being on the show. This concludes our segment on acupuncture. Be sure to visit Austin Acupuncture Clinic if you have any acupuncture needs, and thank you for joining us.